Hi everyone, welcome back to the video series called Guelph and Area COVID-19, a Community in Crisis. I'm happy to bring you the second episode and thank you so much for all the encouragement and the positivity that you demonstrated with the first episode. In this second episode, we did ask Dr. Will Ruddock to just provide a few words of suggestions, particularly around the area of advanced directives and getting ready with some goals of care, discussions with family and primary care physicians. So that will be very important. But there will be more coming on long-term care and retirement homes as the news develops. We have good news from the hospital, and we have interviewed Dr. Jennifer Caspers, who is Chief of Staff at the Guelph General Hospital. The outbreak on 4 East has been declared over. There have been so many preparations. And as usual, the Guelph General Hospital Foundation is also deeply involved. So we'll also hear from Suzanne. The one area that we have not touched upon at this point in time is the development of the Ontario Health Team. And we have Emmi Perkins from the Ontario Health Team to discuss some of the beautiful things that have happened there. And finally, for future episodes, I will be bringing in some different guests from our regional areas such as Fergus and North Wellington. We will also focus on the issue of mental health in the setting of COVID-19 and some resources that are out there in the community. I would also like to thank the people who have sent me some pictures for these videos. I think that really reflects the community spirit we're trying to bring out in these videos. Thank you so much. Keep sending me pictures and please keep sharing this video.
I'd say the vast majority of patients in long-term care are there with very advanced conditions, many of which are progressive and irreversible. And I think we have to be really thoughtful about how we manage things and how we discuss whether, what somebody might want through a challenge, whether it's COVID or another infection or other problems. It's a difficult conversation, but it's one that we all need to get better at and have needed to do so for a long time. So retirement homes, it can be very similar, but the goals of care aren't always the same as in long-term care. People are relatively independent, may have a greater chance of recovery. I think it's still in that setting important to know what somebody would want if they become very unwell and have those discussions ahead of time if we can.
The Guelph General Hospital has done an incredible job of preparing for this COVID event when it hits us. We've done a lot of things in terms of actually extending the patient beds in the hospital, and we have taken our intensive care unit and we've divided it into two. But the COVID patients will be in the old established ICU, and people who are needing intensive care but are not COVID positive will be in the post-anesthetic care unit. We still do emergency surgeries and we still do urgent endoscopies, colonoscopies, and gastroscopies, but none of the routine. So we've made a lot of preparations. The public have been so generous. They've sent all sorts of offerings to the hospital. There have been tributes outside in terms of the rock garden. The public has been very generous. The signs around the city of support, they mean a lot. I think that the public is helping us. We can make all the preparations we like, but when the public stay at home, they don't go out and visit with their neighbors in close proximity, but keep that 6 feet apart, and they are respectful of the need to wash their hands frequently. Those are the things that are going to keep the surge low. I think it's important to recognize that we have a great healthcare team at Guelph General Hospital. I'm exceedingly proud of Guelph General Hospital. I'm also proud of our community. The Guelph Family Health Team, tremendous support of each other. It's been a wonderful experience to work with people who are so skilled.
And so in the foundation, we've always been involved in engaging the community in the work of the hospital and securing donations to help the hospital meet its mission And really, we're still doing that. We're just pivoting a little bit, that those donations now sometimes are in the form of masks, as an example. We quickly became a spot where people were calling, and we were reaching out proactively. So that's one area. We've had amazing support from the community in that regard, from corporations who have thousands of masks that they have secured for us, to individuals who might have, a box in their basement from when they were doing a renovation. Really, since middle of last week, we've had over 1,300 hand-sewn masks dropped off. And it's really so heartwarming, whether it's someone who has sewn 5 or someone who has sewn more than 100. For people in the hospital then who are receiving, for an example, a scrub cap, just to know, wow, somebody in the community who doesn't know me has made this for me. It's going to make a difference to me. It's like almost like wearing a hug from someone in the community. If people are interested in supporting, if they go on our website, gghfoundation.ca, they'll see there's 3 different areas that we have. So one is if you'd like to make a financial contribution. One is if you have supplies that you would like to donate, or you're interested in sewing masks. And the third is if you want to give words of support through the White Heart Project. So all of these programs are, people can get the information they need on the website.
Before we continue, I'd like to tell you a little bit about the Ontario Health Team. The Guelph and Area Ontario Health Team was created in the fall of 2019. The Ontario Health Team has really helped to bring many of the key organizations in Guelph and Area under the same umbrella in order to be able to work together, which has come in extremely handy for the COVID-19 epidemic.
Other organizations who we typically may not partner with came forward. For example, St. John's Ambulance offered their volunteers, who are first aid trained. We had the university. So it really has been not just healthcare partners that have come forward with offers of support, but really all of our community partners. So it truly is a community effort. And so really proud of our community for finding different ways, and our primary care providers for finding different ways to keep our residents and our patients safe and cared for in our community. I'm really proud of our community, really proud to live here, work here, be part of your healthcare system. And thank you for your contributions. We will get through this together and stay strong, and we'll see you on the other side.